so while we have this great comprehensive methodology of detecting these mutations, liquid biopsy or liquid-based testing is a newer modality of testing these treatments in clinical practice, and is another way in which we may be able to test for these biomarkers. And so this has been most done often in lung cancer via circulating tumor DNA, or what's called ctDNA. This is really detecting DNA from the cancer cells that die off and then are released into the bloodstream. And this helps us to detect the potential target within a time frame of approximately a week, as opposed to 3 weeks with our more comprehensive testing. And so this leads to a faster turnaround time if we're able to identify a target. It's a blood test, so it's non-invasive. And there are clinical trials that are up and coming that are looking for us to use this modality as a means of monitoring disease and possibly in the future predicting those patients who are going to be more at risk for relapse. But this is still in clinic or developing in clinical practice. And so comparing the two methodologies, tissue versus liquid-based testing, I think it's most important here to emphasize that while these tests work hand in hand, or that these tests work hand in hand and should not be used alone, they complement each other. Comprehensive molecular testing using DNA and RNA-based next-generation sequencing should be performed. But these, as I said before, these methods take 3 to 4 weeks in terms to get that information back in order to be able to provide a treatment plan at times for patients. Liquid biopsy by ctDNA testing can get us an answer much faster within about a week. But it's important to say that if this if this liquid biopsy testing is negative, we still need as oncologists to look at the tissue as this is the gold standard in order to identify one of these molecular alterations. And so in the age of precision medicine, the sequence of treatment that you'll hear about later is really essential to identify targets if a target's present, because it can have toxicity consequences if we don't pick the right drug at the beginning in terms of giving immunotherapy before a targeted therapy. So while the testing can take time, it is still important to make sure that we are aware of the molecular profile for the patient.